big part of what I do for hips is hip replacements. A number of things that we do see that lead to hip replacement. The most common one is just arthritis. You can also see patients who have had previous traumatic injuries to their hip and develop what we call as post-traumatic arthritis. So our best tool for diagnosing things is really just communicating with the patient and hearing what they have to say. And that includes getting a history. If you've had imaging done in an outside facility not associated with Gardner, get copies of those images on disc and the official radiology report to bring that in. That will help speed up our ability to help take care of you. And after you talk to the patient, then yes, you go through a physical examination where you actually touch the patient, move their hip around, test their strength. And then finally, we really use x-rays. That is one of the main tools that we use to help diagnose and confirm what we think is going on. So an x-ray will show, do you have arthritis? Are you getting arthritis? Is this end-stage arthritis? And really you take all those things, your history, your physical exam, and your x-rays to diagnose hip problems. The mainstays of treatments for those patients are, let's get rid of your pain, right? We do that with, taking over-the-counter medications like Tylenol, ibuprofen, and then oftentimes some physical therapy. And that really focuses on stretching out the muscles, the tendons, regaining normal joint motion, learning to walk more appropriately again to take pressure off the joint, the muscles, or the tendons. You give prescriptions for physical therapy for those that don't need surgery or other modalities, and then yes, if we feel like surgery is the option, we get you a surgical packet, and then my surgery scheduler calls you within 24 hours to get you scheduled. Patients want to be heard. No matter how good that surgeon is, if bedside manner is important to you, find a surgeon that's going to be willing to listen to you, that you connect with to a certain degree. Also looking at that surgeon, how long have they been in practice? What's their complication rate? What's the most common complications you see? If I'm having a certain problem after surgery, how easy am I going to be able to get in and see you to remedy that problem? Those are really important questions to ask when looking for an orthopedic surgeon.